tremor, because we use the tremor monitor because it's a very quantitative approach. So in your mice, do they tremor? They don't.
They are indistinguishable.
So would you then conclude that it's likely that the tremoring is a cerebellar regulated phenomenon?
Well, we have done nothing to actively measure tremor. It's just, sort of a visual that, playing with him, we can't tell the difference except that the one cage has got, is not nesting quite as well. They're beginning now, because I'm talking about the ones that are at about 10 weeks, they're beginning to look a little scruffier, so they're not quite cleaning themselves as well, which is another good sign. But we're not seeing anything else. Yeah.
No, the weight loss is interesting, and I guess the one thought would be that perhaps its MPC1 expression in other areas of the brain are really important. And probably the first place I would think of would be the hypothalamus, because that controls a lot of our satiety and eating centers. So it may be that MPC1 in the hypothalamus is really the reason why we see the weight loss being so characteristic of the mouse model. Although I don't think in humans we see the same, quite the same effect. So I think that's very interesting. It might be something that we could, address a little later on. Or it might be an interesting area of investigation for the role of NPC1 in feeding and satiety.
Well, one of my colleagues at Tufts is a BDNF and obesity and satiety person. And so she's on the thesis committee of the student who's doing this and is very interested in us exploring that avenue.
You're using these antisense oligos to generate your NPC mouse models, and you're watching it progress from a healthy mouse into one that's affected. It might be a good place to begin to identify biomarkers that can specifically be used to evaluate the state of NPC, so that when you're, as Dan was talking about earlier, generating therapy, you could use it to evaluate when they're going back into becoming healthy.
Right. We would love to be able to do that.
Is there anything that you can find that is NPC specific in terms of biomarkers as you watch it go into the state, or if you begin to look at that?
We just haven't had an opportunity to even begin the search.
It's a fascinating project that you've embarked on. It looks great. Thank you.
I would just like to ask, mice are readily available for testing, and we don't do an awful lot of testing on larger animals. How does a mouse life equate to a human's life when you're doing this 2, 4, 6, and 9 week testing?
So the mice become, that's a really good question. The mice become what I would call young adults at what age, would you say?
5 to 8, they're essentially mature by about 17 weeks.
So Dan and Denny are saying they become sexually mature at 5 to 8 weeks.
7 weeks.
And they typically have a lifespan of about 2 years. And so we are beginning normally the NPC mouse would die at about that time, that 7 to 10 week. We're beginning our treatments at about 4 weeks of age. And the treatments are going on, as you saw, for a few months. So they are juveniles during that time, juveniles to teenagers. Thank you very much.
speak this morning. And what I would like to do is to give you a little bit of an overview of the work that we've been doing at the NIH. So what are some of the therapeutic trial issues? Obviously, the question is, what therapeutic approach do you use? And Dan reviewed both the pathology and some of the potential therapeutic interventions that could be used and are being studied. But we also have, so wrapped up in that is what pathological processes do we treat and what drug or drugs do we use. Obviously, if you have something that corrects the primary problem, perhaps chaperone therapy, one drug may correct the disease. If you're looking at some of the downstream issues, such as oxidative stress or inflammation, it's likely that you're going to need a combination of drugs to address those various different aspects of NPC. And then the other problem that was alluded to earlier is if we have a drug that we want to test, how do we know it's working? And how do we know it's working in a time frame that will allow us to adjust the regimen or add a second drug to it? So to try to address these questions, we started at the NIH a longitudinal observational study, and we actually, it's hard for me to put in perspective, but this has actually now been going for 4 years. Our goals were to identify clinical or biochemical markers that could be used as an outcome measure in a therapeutic trial. And another goal was to identify a biochemical marker that could be used for diagnostic testing or screening. And Dan alluded to the fact that the diagnosis, and parents sitting in the room know this all too well, the diagnosis is very hard to make. And in our group of patients, the diagnostic delay is an average of 4.5 years from the first symptom. So the status of the trial, we've enrolled 52 patients since we started in August of 2006. And the observational natural history study really focused on trying to find doing clinical and biochemical evaluations and looking for these outcome things that we can use as outcome measures. So we talked a lot about biomarkers, and I want to just take a minute or two here to explain, what they are and how they could be useful, but also what their limitations are. Okay. Ultimately, if you give a drug or a therapeutic intervention, you want to change something clinically. If the child has ataxia or tremor, you want to lessen that. Ultimately, we want to increase survival. Those are clinical outcomes.